This is a Byja Broadcast Enterprise show.
So more recent estimates suggest that obstructive sleep apnea may affect 24 to 33% of adults. So that's 85.6 million adults with about 68.5 million undiagnosed.
When you don't use it, you lose it. So your heart will not pump and be strong when you're not forcing it to work out. Your heart is a muscle. If you don't work that muscle out, it's going to wear away. And when it wears away, it gets weak. It eventually fails, aka heart failure.
Shortness of breath, leg swelling, ankle swelling, rapid weight gain, abdominal swelling or bloating, trouble lying flat, waking up gasping for air, coughing or wheezing, especially at night.
An LVAD procedure is basically where they take a person whose heart failure is so severe that they no longer have the ability for the blood to pump anywhere close to what it needs to pump. Put it like this, on a scale of 100% and 0%, the heart is pumping less than 10% of blood where it needs to go.
Here comes Byja Radio. Byja Radio. With Dr. Byron Jasper and patient zero.
Welcome to the Byja Radio Show, recording live.
The content in this show is intended for informational purposes only and does not constitute medical, diagnostic, or treatment recommendations. We do recommend that you seek the advice of your physician or other qualified healthcare provider with any questions regarding your health.
All right, we are back once again, the amazing Byja Radio Show with myself, Dr. Byron Jasper, one of your hosts, and I am going to bring in the person everyone comes to see. He doesn't like when I do that, but it is the truth. And, what is it? The whole truth, nothing but the truth. So help you God. I mean, I'm that person. I'm just going to go ahead and, put the hand on the good book and let people know that this brother is here. But before we do that, I want to highlight the idea that we are on the 7th episode of season 5. And we usually do about 11 episodes a season. So that means we're past the halfway point and we've been rolling so much, we didn't even realize it. So if you have not done so, please like, subscribe, share, and follow and do all those things because it's you, the listener, that is making it to where we keep going at Byja Radio Show. And if I'm saying we, again, I've already highlighted the idea that this brother probably is wearing disguises out in public because he's that popular. I've had people stop me and say, where is this brother? And if I'm saying this brother is that popular and people are stopping me and they're asking me where he is, it must be patient zero. So patient zero, how are you doing today, brother?
Brother, I'm doing fantastic, man. I'm just out here incognito, moving in silence. You know what I'm saying? When nobody really knows what's happening. So yeah, I can't complain, brother. Now, I'll say this. People are not coming to see me. They're coming to see you. And it's fine. Like I'm good with being Scottie Pippen, man. I told you last episode, man. It's fine. Everybody needs a Scottie. And look, man, I'm here to when you have your flu game, man. I'm carrying you off the court, bro, just because I'm here for you. So it's all good, man.
There you go. A solid brother, as I always say. And that's why people just adore this man to the point where we actually did some, for lack of a better term, political or civic duties earlier in the week.
Yeah.
And as we did that, and I tell you this, if you're literally a listener, you think we were just recording these episodes and just doing stuff because, we don't have anything to do. No, we actually have lives, people. But why am I bringing this up? Patient Zero is such a solid brother that if you know anything about our clinic, I like to say hood adjacent. We're not quite in the hood, but we're close enough to the hood, if you will. So being hood adjacent, we have basically a neighbor and some buildings next to ours that pretty much probably doesn't need to be there. So we're basically going to our Metro Council meeting to argue about whether or not this building needs to be condemned. And patient zero, the man is so amazing as we walk into the actual building to sit down and get ready for the meeting, he recognizes his classmate who's actually on the Metro Council. I'm like, this guy knows everybody adore. I mean, the guy literally gets up, comes across the room, gives him the biggest hug. They literally grew up together kind of thing. And I was just like, yeah, I'm in the right room with the right person. So the moral of the story is if you ever need something, get you a patient zero is what I'm saying. I got mine. You got to get your own. That's all I'm saying. So patient zero, what are your thoughts when that happened? Because I'm pretty sure that was pretty surprising, but also pretty cool in my mind.
That was amazing, bro. First of all, I love seeing all my people, So shout out to Brandon. No, it was great to see Brandon. Brandon was really important to me in high school because he was 2 years older than me, and we both played football, and we were both linemen. He taught me a lot, and so Brandon has always been a great guy. So I was excited to see him when he true story, when he graduated, he gave me his football gloves, man. Like Brandon just from way back, he's always been a straight up stand up type of guy. So Brandon, it was also good to see Daryl Hurst, a brother who I went to Southern with, man. We took our marketing 300 class together with Miss Albert. So it was great to see him, man. And the Metro Council, man, they just got great people all over the place, man. You got Tawana Harris, who's a great person. Anthony Kennedy's a great guy as well. A member of the greatest fraternity on earth.
Hey,
shout out to brother Kennedy.
no disagreement here. No disagreement here
at all. So there's a lot of great people, and it was good to see those people. But man, it was when I saw Brandon, man, I just remember, changing our shoes to run that 40-yard dash, man, back in the day so we can get a little better time, bro. Like me and Brandon go back, man. We got memories. Like true story, and I'll leave it alone, man. So Brandon's junior year, we had Camp Bulldog, man. So we all had sleeping bags. We sleeping in the gym. They woke us up for a midnight practice. We're going through hitting drills at midnight. We got this big spotlight on the field. One of our classmates, man, is kind of like dragging it because they woke us up at midnight to go practice football, and he like gets knocked out, like unconscious, to where he got taken to the emergency room. So like practice was over. Then the following year we have the little Camp Bulldog, so they say, okay, maybe not midnight practice anymore. We don't want anybody to get knocked out. So they put us on the school bus, and if you've ever been in Donaldsonville, Louisiana, there's a plant called CF, like right by the, right outside the city of Donaldsonville. So they put us on the school bus, man, about 5 o'clock in the morning, drop us off at CF, and they tell us run back to the field house. And I'm like, this is great, awesome. But anyway, I went through that with Brandon. No, man, Brandon's a great guy.
Yeah, I feel like you trauma bonded, as they say. So at this point, y'all thick as thieves. So man, that's great. But
and look, shout out to Coach Bucky, man, Bucky Bastretta. He's in the Hall of Fame. He's Coach Bucky and Coach Vice, our defensive coordinator, man. When you talk about Louisiana football legends, those guys are like with the cream of the crop, man. So shout out to those two, man, for all the guidance over the years and making us trauma bond with each other. But yeah, it was great times, man. So it was good to see Brad.
There you go. Well, all right. I'll jump into one thing and then we'll jump in today's episode. We are on season 5, episode 51, my brother. So episode 51, and episode 51 is going to be about 2 topics. Hopefully we can do justice to both topics that I believe a lot of people have heard these letters and or heard these names and have some idea about them, but don't know about them perfectly well to where they feel confident in having a discussion about it unless they've been diagnosed themselves or they have someone who is an immediate family member. So our goal is to educate folks and make sure they know a lot more about these types of things. So the first thing we're going to talk about, patient 0, are the diagnosis I will say is going to be the letters OSA. And off the top of your head, I'm sure you know what the last 2 letters are, but what would be the first letter in the OSA diagnosis if we're talking about this, my friend?
So I feel like I got this right. I don't know. It's not in the notes, but I feel like I'm about to get it right. Obviously, the SA is sleep apnea, but I want to say the O is for obstructive.
There we go. There we go. Apnea. There you go. Sticking the landing. Like I said, maybe an episode or 2 ago, you were 9.8. So at this point, that's a perfect 10, my brother. You stuck that like it was nothing. So we are going to start off.
Dominique Dawes, gold medal.
You're going back. Oh, but speaking of that, before we go back, you possibly had a number. I said 51. I didn't even think to throw it to you. What's your number, 51? I know you always have a sports number or a story about these numbers. So what we got with 51?
So, man, as everybody knows, I'm a big Saints fan. And so we just a little bit. What is the seventh episode of the season, episode 51 overall. So I think about the Saints Ring of Honor, And there's two people in the Ring of Honor. Martin Anderson, who's a Hall of Fame kicker.
Mm-hmm.
You know, he's in Saints Ring of Honor. He wore number 7. And number 51, his teammate is a guy named Sam Mills. They call him the field mouse. And Sam Mills was part of the Dome Patrol, one of the baddest linebacking corps, probably the baddest linebacking corps in NFL history. But those two numbers always go together because the Saints won a lot of games with those two on the field because the defense was amazing, and all you had to do is cross the 50 and kick a field goal because they wouldn't score many touchdowns. They was winning games like 3-0, 9-7, stuff like that. But yeah, so those two numbers go together for me. And a little trivia. After Sam Mills left New Orleans, he went to Carolina, and he always used to use the mantra, keep pounding. He would always say, keep pounding, keep pounding. So Carolina, their whole identity, that keep pounding, comes from a guy who's actually one of us. He's actually a Saint. So you're welcome, Carolina. You know.
So basically, they should give us the credit, is what you're saying.
They're nothing without us.
Gotcha. All right. Well, let's get back to the task at hand, my brother. So we're going to talk about sleep apnea, specifically obstructive sleep apnea. But let's start with the basic definition. Then I'm going to kick it to you, patient zero, to give the folks some stats. So sleep apnea is basically a sleeping disorder in which a person's breathing repeatedly stops and starts during sleep. That is the most basic definition. And there are different types. There's obstructive sleep apnea. There's central sleep apnea. And I'm only going to give you those two because I don't want to get too far into the weeds on the different types. But the idea is that during a person's sleep, they stop breathing, and then they start breathing, and then they stop breathing, and then they start breathing. So these breathing interruptions can be very frequent. They can be infrequent, but a lot of times they're occurring dozens or even hundreds of times per night, patient zero. And as that happens, that stop breathing happens, it reduces oxygen levels and basically disrupts normal sleep patterns. So that's the true definition, very, very basic. And with that, you stop breathing, you start breathing, and that can happen a couple times, it can happen dozens, it can happen hundreds of times, and it causes problems down the road. And we're going to talk about those problems, patient zero. But before we do that, let's talk about some statistics, patient zero. And why do we love numbers around here, patient zero?
Because numbers don't have an opinion.
There we go. So based on that, my friend, why don't you give the folks some numbers or statistics about sleep apnea? And again, we may talk more about obstructive sleep apnea or OSA. So that's the numbers we're going to focus on compared to the other types because obstructive is usually the more common one. So what you got, patient zero?
Sure. So obstructive sleep apnea affects nearly 30 million Americans. Just a couple people. You know, 30 million people, that's a lot of people, bro. But yeah. So 80% of the cases are undiagnosed. So you got 5 people that got sleep apnea, 4 of them don't know. Or they probably do know, or their spouse knows, but they don't know, right?
Somebody know, right? Somebody know.
Somebody know. Because somebody else can't sleep with all that snoring. But anyway, so more recent estimates suggest that obstructive sleep apnea may affect 24 to 33% of adults. So that's 85.6 million adults with about 68.5 million undiagnosed. Again, people don't check on themselves. They don't get any care. And, sleep apnea can cause some bad stuff. So that's a lot of people that need to get in care and get diagnosed with this. But anyway, there was a prevalence estimate in 2025 that placed obstructive sleep apnea amongst adults around 32.4% overall, including 39.1% of males and 26% of females. So I don't understand why males got it more than females, but whatever. But anyway, I digress. So in several U.S. states, symptoms were very common in terms of loud snoring. 41% people reported loud snoring. 13.6% of people reported stop breathing during sleep. 20% of people reported unintentionally falling asleep, including patient zero, because I do that all the time. And 75% reported at least one other sleep disorder symptom. right?
All right, patient zero. So thank you for hitting them with the statistics and going over things. So again, we always are going to try to get your feedback on some of this because we believe that some of this is relevant into from a patient's viewpoint. What do you think about these numbers? I think you've already kind of told the people what you think, like, hey, these are common, this a lot, or look, not surprised at all. What are your thoughts on some of these statistics for sleep apnea patient zero? And then we're going to go into different things like symptoms, signs, and risk factors.
Well, so I'm very familiar with sleep apnea because I've been diagnosed with sleep apnea, and I have a CPAP machine, and I sleep really well with it. It's actually kind of changed my life a good bit because I feel more rested, and I feel better because I have it, right? So what I'll say is none of this is surprising to me. Again, sleep apnea is one of those things where it doesn't have a runny nose. It doesn't have a bruise. It doesn't. So I feel like it's going to go unannounced because people just don't see it every day. It doesn't affect you directly like a disease would, right? It's more of an indirect effect because, it doesn't really make you sick. So I'm not surprised that it goes undiagnosed. And B, some people don't like what you need to fix it, right? Because don't get me wrong, I like my little CPAP machine, man. You know, uh, I sleep good with it. I feel good, but it ain't
Mhm.
sexy. Like it's just not sexy, bro. Like it's a little machine. It kind of sounds like a little quiet ventilator. You put that stuff on your face, man, and you put it in, you put it over your nose. It's not cute. So I can see why people just don't want to deal with it. But I feel better that I have it. So I said all that to say, I understand why it goes undiagnosed. So that's not surprising.
Gotcha.
It's not surprising that 40% of people snore. It's not surprising that the only thing that really took me by surprise was the fact that it's much more prevalent in males than females.
Hmm.
And I don't really understand why. But other than that, none of this is surprising at all.
Okay, good. Well, we'll possibly get into why it's much more prevalent, but I'm agreeing with you in that a lot of it is not surprising. Of course, to me being on the medical side and seeing patients and diagnosing patients with this, I'm not surprised at all by these numbers. And I do think, like you said, a lot of it is underdiagnosed because people tend to just think it's normal to do this. It's normal to feel tired after I slept all night. It's normal to snore. And I've been snoring for 10, 15 years. It's not a big deal. It's normal to have the problem where I wake up coughing or gasping for air and then just go back to sleep. All that's normal, or that's normal for me, so I'm not worried about it. So I do think it is problematic, and I do think these numbers are accurate, and it's not surprising to me. But as we talk more symptoms and signs, you'll start to say, okay, maybe I now understand why the women have it a little bit less than men. So what we'll do is jump to that, and then we'll come back to risk factors, patient zero. So symptoms. I'll start with a couple, and I'll start with the ones that I know people are going to be potentially surprised about. But I know you're going to go into some of these and potentially come back and say, yeah, look, these are not surprising. So we'll start with the most common symptoms. Patient zero, I'm sure you know some of these, but I'll go with the ones that are probably the least surprising. All right. So loud snoring, witness pauses in breathing, as I just talked about, gasping or choking during sleep. So people are like, what you mean gasping? Well, if a person's snoring and breathing and snoring, and all of a sudden they start coughing or trying to clear their throat, and it almost sounds like they're choking, then they basically move or reposition themselves, and then they start breathing and snoring again. That's what we mean by the gasping or choking during sleep. And then the last one that I will say is potentially waking up with a dry mouth, right? You snore and you're breathing through your mouth so much you wake up a dry mouth. So those to me are the least surprising symptoms. What would you say, patient zero, from the list? And we got two sets, right? I'm going through the what we will call potential nighttime symptoms. Which ones are going to be the most surprising to you that you have in front of you, my friend?
Large neck circumference.
So would you call that a symptom or a risk factor?
It is a risk factor.
Okay. So what are
I
I'm
missed
talking about
that.
symptoms, specifically
So
symptoms.
I'm gonna go to symptoms. Night sweats. Like, why you sweating? Because you can't sleep or you can't breathe. I guess your body temperature is hotter
Mhm. So
because
ultimately,
I don't know. Go ahead.
Well, I was going to answer that for you. So, why would a person start to sweat when they can't breathe? Well, think about it. Your body's in a panic state. Your body is literally starting to feel like it can't survive. So, it's going to start to react in a way of what we would call fight or flight, right? So, imagine when you're running and you start having shortness of breath, you start sweating, right? So, your body starts to basically, the best way I can explain it, it starts to mimic like it's running, right? I'm breathing so short and I'm not getting enough oxygen. I start sweating, trying to basically get more oxygen into the body. So, yes, night sweats makes perfect sense from a medical standpoint. And it's not something people tend to put together that, hey, I'm having night sweats because I'm having sleep apnea. But yes, it can happen. What other ones you got, patients here? I'll give you two more that I would think you may be potentially like, oh, I'm surprised by it. But now when we go through it, it makes sense.
Ankle swelling?
I can give you that one, and that's going to tie into the second segment, but that's a good one. Any other one? So I'm not going to spoil that one, but any other one that you would say. And again, you got a few of them.
I would say trouble lying flat.
Okay. So for that, I would give you that one as well. All right. So these are the ones that I would say are probably more surprising that people are potentially from a symptom standpoint, right? Now, we're not talking about risk factors. We're talking about symptoms. So to me, symptoms are excessive daytime sleepiness. Hey, I slept all night and I'm just exhausted. To me, it's a surprising thing when I say that to people that, yeah, that's a symptom of sleep apnea. And a lot of patients are like, oh, that's why I'm so tired all the time. I'm not breathing well at night. So now I'm exhausted the next day. I never thought those two go together. So that's a surprise for people. Headaches first thing in the morning is another surprising one. I woke up and I have a headache every morning. I don't know why. And I just slept all night. I drank plenty of water, but I still have a headache first thing in the morning. And then, of course, potentially low energy, being irritable, and having poor concentration. All of those are symptoms that are sleep apnea related. But people are surprised when I say, yeah, you could be more irritable because you're having trouble breathing at night. Just usually don't put those together.
That makes sense to me though,
Mm-hmm.
because think about it. You didn't sleep well, so you're naturally irritated. That makes sense. Or you didn't get the oxygen that you needed at night, so now your head hurts. That makes sense.
No.
You didn't
Now
rest
again,
like you.
well, let me push back. I didn't say does it make sense, and you are diagnosed, so you have a bias, right? Your bias is I already know some of this. Now imagine if you're sitting here and you've never been diagnosed. If I say, well, do you have headaches in the morning? People won't say, you know what? It makes sense because I don't breathe at night and therefore I have a headache. It's yeah, I have headaches. What does that mean? It doesn't mean anything, right? Yeah, I didn't sleep well. I'm a little bit annoyed, but not 4 or 5 years of being annoyed. So that's why I would say surprising. It's not saying that it's the most surprising. People will never get it, but I think those that are not diagnosed, our listeners that may have no idea what sleep apnea is, this is the first time they're hearing about it. They have a family member who snores and they're like, oh, do you always talk about taking medicine first thing in the morning for a headache? I never put two and two together. That's what I was coming to for that kind of explanation.
Mm. I guess just when I was diagnosed with sleep apnea, and you explained to me like what it actually was,
Mhm.
and maybe everybody doesn't have that doctor that's gonna be as thorough as you, right? So shameless plug for the clinic. Come on, but what I'm saying is you went down and you explained what sleep apnea actually was. So when you told me what it is, these symptoms, I was like, okay, this makes sense. Like I get it. So like when I was reading through these, I was like, okay, headache in the morning, okay, irritability. Of course you will be irritable. Like it just I didn't I wasn't surprised even when I first was diagnosed with it. I wasn't surprised at any of this because of how thorough you explain what this actually was. You
Mhm.
know what I'm saying?
Yeah.
So maybe that's why I'm not shocked, and maybe everybody should be a part of the clinic.
I'm going to say yes to that. No argument here. But what I'm hearing is that patient zero is just amazing that he basically isn't surprised by this anymore. He's so well versed in this medical stuff that eventually we're going to get him to be Dr. Zero. And once that happens, I mean, again, watch out, right? He's already in disguise, people. He's already walking around in disguises because he's so popular. Imagine when he now has that stethoscope around his neck and it's a layup for him. So he's not surprised. I know some people are probably listening to this and they are surprised. And I'm saying that because from experience, I will tell people this and they give me this look like, you know what? Now that you say it, it makes sense. But before that, I just thought I had a headache. I never thought that it was related to me having trouble sleeping. I thought that I would basically have night sweats because, something else had to be wrong. I thought I had an infection or something. They never put it together about the lack of breathing. And of course, the next day being very fatigued, even though they slept, quote unquote, 8 hours. They slept 10 hours, but they're still exhausted. Those are all surprising for a lot of people. We also didn't talk about falling asleep while watching TV, even sitting still, reading the newspaper, reading a book, and maybe even driving. All those are things that people tend to have, patient zero. And it's sometimes a surprise that those symptoms are related. So I think we covered most, if not all, symptoms. We're going to go into risk factors, patient zero. So I want you to roll through these if you don't mind, because we want to
Before
make
you
sure
go,
we're good on time. But go ahead. Go ahead.
before you go there, man, I thought I was a terrible person, man, because before I was diagnosed, man, every time I crack open the Bible, I'd be asleep, and I thought I was a heathen, but but it was just because I had
I'm just,
sleep apnea, and I didn't know.
I'm going to say this. Two things can be true still.
Man, I go to mass, I get my communion.
Two things can be true, brother. I'm just saying. I'm not going to say it's not sleep apnea. I'm not going to say it's not heathen-like activities. I'm just saying, brother, I think ultimately the jury's still out. We got to work on both. That's all I'm going to say.
Hey, man, I go get my communion every Sunday, man. I was feeling bad. I said, God, every time I open this Bible, I'll be asleep. But, I had sleep apnea, I didn't know.
That's funny. All right. So with that, risk factors, my friend, let's go through all of them and let's make sure we circle back to eventually, of course, evaluation. We're not going to obviously talk about tons of treatment, but we'll at least highlight them. So let's go through risk factors, brother.
Okay, risk factors. Where they go? Here we are. High blood pressure, coronary artery disease, prior heart attack, diabetes, obesity, chronic kidney disease, atrial fibrillation. I don't know why
All
I
right.
can't talk today.
I'm going to time you out. You on the wrong set of notes. You didn't scroll down, my friend. So you got to go way back up. See, look at you trying to be patient zero and Dr. Zero. You done went to the wrong set of risk factors. So let's go to the other risk factors. What are the risk factors for sleep apnea?
Oh, there we go. Oh, here we go. Some of them are the same. My bad.
All right.
I went too far now.
Yeah, exactly. Can't give you all the notes at once. We got to start breaking your notes into smaller segments because you read ahead, I see. Let's go to
So I
sleep
do read
apnea.
ahead and look, man, I need to look at this on a bigger screen, man. But but anyway, I'll bore you with my IT problems later. So risk factors, obesity, still, large neck circumference, male sex. I don't within the male sex, got it. I'm like, male sex. Yeah, I'm like, I definitely want this. But
Keep going.
wait a minute. Okay, got it. Nasal obstruction, enlarged tonsils, craniofacial anatomy.
All right, let me take over because I know you have some IT problems. So you said obesity,
Well,
large neck circumference. Being basically male gender would be another way to say that. Being older, having older age, because children are less likely to have this, right? Family history, excessive alcohol use or regular alcohol use, being a smoker, taking a lot of sedatives or sleep medicines, and as you said, having a nasal obstruction, enlarged tonsils, craniofacial anatomy being pretty much irregular, and then last but not least, being postmenopausal if you're a woman. All of these are risk factors for sleep apnea. Now, it doesn't mean you have to have more than one to get to this, right? You can have one of these and still somehow have sleep apnea. Now, the other part is you can have none of these and still have sleep apnea. We have people who are not obese that have sleep apnea because they have a large neck circumference or they have a family history or they have bad anatomy or irregular anatomy. So the point is, don't feel like, well, I don't have 2 or 3 of these, so I must not be at risk for this. No, you still can have it even if you don't have these. Those are exceptions to the rule. But if you have a lot of these going on, you're more likely to have this. So patient zero, any risk factors that stood out to you that you say, yeah, these are ones that I kind of knew. These are some that I did not.
So obesity was one that I knew.
Mm-hmm.
Large neck circumference, had no clue. That never occurred to me. Family history makes sense. Alcohol use, I don't get it. That don't make sense to me. I guess smoking, once you mess with your with your past your pathways, I guess, for lack of a better term, that could make sense, right? Nasal obstruction makes sense, enlarged tonsils make sense. But yeah, the large neck, I never even thought about that one.
Well, let me give
And
you the.
and why are males?
Mhm.
I don't understand what's the difference between a man and a woman in terms of anatomy that'll cause sleep apnea. Obviously, but I don't understand what that has to do with sleep apnea.
Well, I'm going to say that to answer your first question about alcohol. So, the way alcohol potentially affects people that may make you more likely to develop or have sleep apnea is basically alcohol causes the muscles in your neck to relax. Just like alcohol is basically a soother, a downer, as we would say. So, the muscles in your neck start to relax and it collapses to where your airway, which should be open, starts to basically close because it's less rigid, it's less in contraction, if you will, right? Like if you're holding up a dumbbell, your muscles are engaged. So whenever you drink alcohol, those muscles stop being engaged and they start to fall and it closes your airway off, which makes it to where you're having more sleep apnea, more trouble with breathing, more obstruction. So that alcohol can cause the relaxation, which causes problems. The large neck circumference is the same thing. If you have an excessive amount of weight and fat around your neck, it's going to make your airway narrow or closed. And if it's more narrow, more closed, more obstruction, more problems with sleep apnea. And then, of course, as you just said, well, why are males more likely to have it? That goes back to, again, anatomy. Some male anatomy is a lot larger and usually a lot more problematic when it comes to the breathing, where all of a sudden the narrowing of the airway happens because they have a larger neck circumference, different anatomy that may cause structures to fall in ways that women may not. So that may be, again, reason why people are more likely to have it from a male standpoint. So those are just a few. And again, we won't spend a ton of time on it because we could talk about all this line by line, bullet by bullet, days on days on days. So let's jump into testing, evaluation, and what are some things people should do to get tested and evaluated. And then we'll hit really quickly on types of treatment that people can consider if they have this. So let's go through them real quickly, patient zero. So testing and evaluation before people are potentially treated for sleep apnea. What do you got?
So you got detailed sleep history, bed partner observations. I mean, that's a good one. Makes sense. If you're snoring, you need to know. Blood pressure check, BMI and neck circumference, and airway exam. Those are all, testing and evaluation before treatment.
And there are a few others that I'll jump into and say because patient zero covered the ones that I think are pretty straightforward. So we in the medical field, when you come to a clinic, we have tools that we will do where we call them screeners. And we'll ask you very specific questions that get a score. And based on that score, it puts us at a higher risk for sleep apnea. We're more likely to say you need to go to the next step in evaluation. And the more common evaluation that most people are familiar with are called basically sleep studies. The medical term is called polysomnography, which is basically saying you're going to have a sleep study. And when you do that, you can do one in lab where you go to a place and you do one in-house where you stay at that lab, or you can take it home and do an at-home sleep study. So those are going to be your common things of evaluation. Again, when it comes to those sleep studies, they'll give you a score and tell you how many times that you have what we call an apneic episode, how many times you stop breathing, how many times you have apnea, which is a lack of breathing. And if you have 15 or 45 or 100, that tells us you're having a lot of sleep apnea or a little of it. If you have none, then you have none. But the goal for those evaluations are not only to arrange whether or not you're going to need a sleep study, whether or not you're going to need to go into and do an at-home sleep study or in-lab sleep study, but then after we tell you have sleep apnea, we talk about how do we treat it. So based on that, patient zero, let's just jump to treatment. We're not going to talk a lot about exactly who uses what, but what are some of the treatments off the top of your head? You already told people. It's not in your notes. You already told people one of them. What is one of the treatments that you think everybody is going to know when it comes to sleep apnea treatment?
CPAP machine, easy.
CPAP machine. Now, $1 million question, patient zero. See if you can stick the landing. What does CPAP stand for? There you go. I figured as much. Most people don't know what it means because, of course, most people like the analogies or like the acronyms. So CPAP stands for Continuous Positive Airway Pressure Machine. So basically what it does is it pushes air into your air or windpipe, as we call your trachea. And when it pushes air into it, it makes sure that the air opens up the airway in a way where it's continuous And that flow of air goes into the lungs, helps oxygenate the blood, and keeps you basically from having these drops in oxygenation, which causes problems. So based on that, the CPAP is the standard that most people do. Other things that people will use for treatment are what we call oral appliances. Basically think like mouth guards and things of that nature, where you can basically put these in and they hold your jaw and your anatomy in place so they don't close the airway and have problems. Those are usually things you would have to go to a very specific type of dentist to get done, where they make these for you, like they fit your mouth and they literally do impressions with clay and things of that nature. And then they take it and then send it off and make an actual oral appliance. Mouth guards you buy over the counter, those are okay, but these oral appliances are fitted to you and they're more likely to last and be durable compared to the ones you buy over the counter. Last but not least, the biggest one that I will say, because there are more, these are the 2 or 3 that I think people would like to know about, that if you don't have the ability to do a CPAP because it annoys you, your breathing is bad, you can't stand the mask, then an oral appliance may be something you want to consider. And then, of course, if you've done the oral appliance, it doesn't work, maybe you do need a CPAP. But the last one is one that everybody probably can do. It's really and truthfully more than likely, if you're an obese person, is weight loss. If you lose weight, it tends to help the CPAP. It tends to help the oral appliance to where you don't need it as much. So those are usually huge things that people need to know. And if they do a good job with those things, they potentially can work their way of not having as much sleep apnea. And then some people may work their way out of having it all together. But what I mean by not having as much is if you went from having trouble breathing 50 times at night with lower weight and obviously an oral appliance, you may go from 50 down to 15. So again, you still have it, but it's not as bad. So that's something to consider. So patient 0, we went through sleep apnea. I think we did a good job. What are your thoughts? Anything you want to close out with for segment 1?
Nah, man, just as always, just pay attention to, how you sleep, because, I feel like every episode we talk about people not sleeping and it's not, and your body not healing and doing what it needs to do because of a lack of sleep, right? And just sleeping is just so important to your overall health. It's just something I say pay attention to. Pay attention to, and if something's not right or if you're not feeling like you think you should have the type of energy you think you should be having, then get in care and check on it, because again, I feel a lot better now that I know that I had sleep apnea and I know what to do with it. So just pay attention and check on you and get in care if you need to.
Yeah. And I will say really quickly, my closeout for segment 1 is that not only getting in care, but pay attention to some of the small things. If you constantly are being told you snore, you're constantly having trouble with blood pressure, you're constantly having trouble with headaches, these are all things that could be warning signs of sleep apnea, but it's also more of a warning sign that you need to get into care and get evaluated. If your partner is tired of you snoring and you think it's just them being annoying or whatever, that's fine. And you think the solution is just to sleep in another room, that's still not treating your problem. It's just basically putting a Band-Aid on a hemorrhage. So please consider getting evaluated and having a conversation with a medical professional, not DIYing it and thinking buying a mouth guard is the fix of all fixes. Get into care, have someone evaluate you, and make sure they do a good job of getting you not only the explanation of what the sleep apnea is if you have it, but also how to get it treated. So that's it for segment 1. We're going to close out and we'll be right back after this. Hello there, it's Dr. Jasper from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long wait times to see your physician, rush visits, and the sky-high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today. All right, we are coming back in for segment 2, episode 51. I was about to say episode 7, but it's the 7th episode of season 5, but episode 51 overall of Byja Radio Show. Your host again, Dr. Byron Jasper, and I'm with patient 0, and we are talking about our second chronic disease that has 3 letters. We went through the first 3, which was OSA, patient 0. So now we're going to the next 3 letters, which I'm sure you're going to be a fan of, and you're an expert. And those 3 letters are CHF. CHF, Charlie, Hotel, Foxtrot. Hey, that's my shout out to my military people. Sometimes I forget them.
Hey,
Remember that, right? So for CHF, what you got? What is the word or words that go with CHF, patient 0? I'm sure you know this one.
congestive heart failure.
Congestive heart failure. That's right, my friend. So congestive heart failure, in so many words, is basically when the heart is not pumping the way that it should, where blood should be going out, for lack of a better term, the front door of the heart, but instead it backs up into the house and eventually goes out of the back door and causes problems. That's my simplified answer and explanation. And basically what that means is the heart is not as strong as it should be to pump blood forward out the front door. Instead, it goes into the heart and stays there where it shouldn't. And eventually it gets so weak that it starts to back up and goes back into places like the lungs and things of that nature. So it doesn't mean your heart has stopped. It doesn't mean heart attack. A heart attack is something different than heart failure. 2 different diseases, 2 different diagnoses. But the idea is that heart failure is when the heart doesn't pump the way it should and blood starts to flow in the wrong direction. So patient 0, let's jump into statistics about CHF. What you got for us, patient 0?
So nearly 6.7 million U.S. adults age 20 or older have heart failure.
All right, I'm going to just stop you right there.
6.7 million people.
20 or older, my friend. 20. 20. Okay, what's your thoughts on that? I just want to get your thoughts right off the rip on 20.
So
20 or older, I'm sorry.
When you hear congestive heart failure, at least for me, I think of older people. That's my first thought. Now, obviously being a sports fan, I remember people like Reggie Lewis and Hank Gathers and other people that were fairly young and passed because of heart issues, on the basketball court, right? But when I hear age 20 or older, you should be healthy enough to where your heart is doing well at age 20. And it's just mind blowing to me when I hear young people that young have congestive heart failure.
Yeah. And it's pretty sad, but it does happen. Okay. So we'll come back to that. I just wanted to make sure the 20 or older part sunk in for some of our listeners. All right. What else you got
Right.
in terms of statistics?
So in 2023, heart failure was mentioned on 452,573 death certificates in the United States and accounted for 14.6% of all causes of death. So in 2023, heart failure was mentioned on almost 500,000 death certificates. And it accounted for about 15% of all causes of death. That's a lot of death. And when you think of this, obviously, a lot of people need transplants and things like that. But every time I hear heart failure, I can't help but think a lot of that is from not taking care of yourself over years. Now, some people may have like might be genetically exposed to some type of family history, right? But most of the time, I would assume that a lot of that is tied to poor health over like the years, right? But that's just a lot of people. Also, more recent estimates report heart failure costs somewhere to be around $32 billion in direct medical costs and $14 billion in indirect costs in 2020, with projections of possibly reaching $142 billion in 2050.
Yep. And one more stat I'll throw in is that it said heart failure cost in the US was estimated at 30.7 billion in 2012, which included healthcare services, medications, and missed work. So again, we're in the billions and it's only going up, right? It's not necessarily going down or, stabilizing, if you will. It's only going up. And obviously, people are dying from this and dying in a huge amount. And of course, it's affecting young people all the way up into older people. So those three stats alone, I think, paint the picture of how common this is, how problematic it is, and more importantly, how deadly this is if we don't get it under control and get in treatment and diagnosis soon, especially if it's something that's chronic in nature. Okay. So we've talked about the definition of what it is. We've talked about some statistics, patient zero. So now we'll talk about some symptoms and potentially signs that people may have that will help them hopefully understand that they may have sleep apnea, right? So with that, patient zero, what are some of the symptoms that you have? And again, we have a lot of symptoms, but I want you to definitely go over the ones that you may say, yeah, these are some that I think are pretty significant, or ones that are surprising, or ones that just stand out to me. What you got, patient zero?
So these make a little bit more sense now that I'm reading for the right disease, right? But, you know, fluid overload symptoms, shortness of breath, leg swelling, ankle swelling, rapid weight gain, abdominal swelling or bloating, trouble lying flat, waking up gasping for air, coughing or wheezing, especially at night, low output symptoms. And then you have fatigue, weakness, dizziness, poor exercise tolerance, so like poor stamina, confusion or brain fog, cold hands or feet. So those are all symptoms.
Yep.
I think the one that stands out to me is cold hands or feet. That I don't necessarily I guess because your blood is not circulating the way it needs to be, and it doesn't get all the way to your extremities. I don't know if that's why, but that to me is the one that kind of stands out the most, because the rest of it makes sense to me.
Well, let's go through these, right? So you said fluid overload symptoms versus low output symptoms. So the definition that we talked about earlier when it comes to sleep apnea is twofold. One, the heart is not as strong as it should be, so it doesn't have the ability to push the fluid out the front door, because all the doors or valves in the heart have a lot of pressure to close, right? They open and they close, right? So boom, 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 boom. So when they're opening, there's a lot of pressure you have to overcome to push the door open. When your heart is really weak, it doesn't have the ability to pop the door open the way it should. So it may pop it open, but it doesn't pop it open fully. So when it doesn't have enough strength to push forward, the blood goes backwards. So when it goes backwards, the first organ that comes before blood hits the heart is the lung, or lungs, depending on the person. So if you have blood that can't go through the heart because the heart isn't strong enough, it goes backwards to lower pressure. Lower pressure means it goes into the lungs. So when it goes into the lungs, what's the first thing you're going to possibly have? Shortness of breath. So people start to get really tired and really fatigued because they can't breathe. Then when the lungs get filled up, eventually the fluid has to go somewhere. It's not going to go forward. It has to go backwards. The lungs are filled. So now it goes out the lungs into the legs. That's where the blood potentially pools. So the legs and the ankles start to swell. And then, of course, as you're swelling, the fluid's not going the right direction. It makes you gain weight. So all of this makes sense when you understand what we call physiology of the heart and physiology of blood flow. And then, of course, when it's a problem, it's pathologic, we call it pathophysiology. So when you have the pathophys down, you start to learn why all these things happen. And of course, if you're full of fluid, when you go to lie down, the fluid is going to be very much pooling in your lungs. It's going to now go into your windpipe or your trachea. So now you feel like what? You can't lie flat. So it makes perfect sense when we understand it. And it makes perfect of breath, more leg swelling, more ankle swelling, more coughing or wheezing, especially when you lie flat, or you just can't lie flat. And that's the overload symptoms. The output symptoms, if the blood isn't going forward, my friend, then it's not going where it should go. You are going to have more fatigue. You are going to have more weakness. And you just said, look, I'm going to have cold hands and feet. Well, why? Because the blood going backwards is not going to where it should go. It's going to go to the hands and feet, but it's in wrong order. So it doesn't have oxygen in it. If it doesn't have the right amount of oxygen, it starts to get cold, right? So those are all things that are going to be problematic, my friend. And again, it's not surprising to me, but it can be surprising to a lot of people, where I say, well, yeah, your hands are freezing because you have really bad heart failure. Your legs are swollen because you have really bad heart failure. You're so tired because you have fluid all in your lungs because you have bad heart failure. It's having to get them to understand the concept and the physiology and the pathology. And then now we can try to fix the problem or at least treat it. So with that, patient zero, any thoughts? And if no thoughts, we're going to jump to risk factors.
Man, you explained that perfectly. So yeah, we can run the risk factors.
All right. My favorite one says, I'm happy you said that because I was hoping you wouldn't say, yeah, let's go over a lot more of theory and things of that. I love this list. Now, you kind of alluded to it earlier, and if people obviously were paying attention, they will kind of put two and two together. But what do you think is one of the biggest risk factors of sleep apnea? I blew it myself. I'm too excited. What do you think one of the biggest risk factors of heart failure is that people tend to not put two and two together? What would you say, patient zero?
Just reading my crystal ball, I'm going to say sleep apnea.
All right, absolutely. So uncontrolled sleep apnea will actually eventually lead to heart failure. I'll say that again. Uncontrolled sleep apnea will eventually lead to uncontrolled heart failure or irreversible heart failure. So based on that, patient zero, what are your thoughts on that? Does that surprise you, or is that something that you say, you know what, I kind of get it now?
Nah, that doesn't surprise me at all.
Okay.
So I get it. It makes sense. And that was part of the reason why I paid all that money for that not sexy machine that I sleep with, because I didn't want this. I was like, look, give me the not sexy machine, bro. I want to keep my heart healthy.
Well, I'm put it like this. You tell people, my approach oftentimes when I talk to people in the clinic is to hopefully break it down to them in a way where it's very practical, but also sensible. But sometimes you just got to be real direct with people. I said, look, you can feel like you want to feel sexy because you don't want to wear the CPAP, but I'm pretty sure heart failure is not sexy either. It's probably even less sexy than CPAP, right? You can't even actually walk from your bed to the bathroom without getting short-winded. And now you think you're a sex machine. I don't think that makes sense. So I think the idea of getting your sleep apnea treated to avoid long-term chronic issues like heart failure is probably a better idea. That's just me. But, people are people, right?
Yeah,
all right. So what other risk factors you got, brother?
So high blood pressure, coronary artery disease, prior heart attack, diabetes, again, obesity. Obesity is just a risk factor for everything. But you get all kind of stuff if you're fat. But chronic kidney disease, atrial fibrillation, valvular heart disease, all right, cardiomyopathy, Byron's favorite, sleep apnea, smoking, heavy alcohol use, family history, sedentary lifestyle. So,
All right.
laying on the sofa is can lead to heart failure.
And
It's a problem.
Yep.
So there's a lot of things.
So it's a lot of things, but the ones that I think people may not really and truthfully, I wouldn't say understand, but maybe, like you said, be surprised about is the word that I keep using, is not getting up and moving. And you're like, well, I didn't do anything bad. I wasn't a smoker. I didn't drink a lot of alcohol. How do I have heart failure? Well, you also didn't get up and move. You just sat on the sofa or sat in your lawn chair doing nothing. When you don't use it, you lose it. So your heart will not pump and be strong when you're not forcing it to work out. Your heart is a muscle. If you don't work that muscle out, it's going to wear away. And when it wears away, it gets weak. It eventually fails, aka heart failure. So now you have heart failure. It's because you just didn't move around. So one of the best workouts, patient zero, and I'm going to throw you hopefully a small alley-oop on this one. I think you're going to get it. It's not running. It's not biking. It's not swimming. But one of the best workouts for the heart is what, patient zero? And again, nothing intense. I want you to think the most basic thing that it could be that may help your heart. What do you think it is?
It's military calisthenics. No, it's walking.
Walking.
It's walking.
I'm not going to say you're wrong about military calisthenics. I've never done it, but it's walking, right? Like you'd be surprised when I tell people you will live longer just going outside and walking.
And take a walk.
Well, no. What's my favorite, patient zero? I'm going to give you this one. And when I mean favorite, I mean the most sarcastic way. What do you think they say counts for walking when I tell them they need to go out and start walking? What do you think the first answer I get from most people when they say about their walk?
I walk to the car.
Close. I walk a lot at work. That's my favorite sarcastic response. Man, I do a lot of walking at work. I don't care. It does not count. I know you think that you walking from your desk to the vending machine and back to your desk and to such and such's desk and to the parking lot counts. But the problem with all of those is those are not ongoing, continuous walking patterns. Those are walks that you do and you stop. And you walk and you start talking to somebody and you stop. So those don't count. Walking that we're talking about is where you basically get out, you start walking, and you don't stop for an extended period of time. That could be 15 minutes, that could be 30 minutes, that could be 2 hours. But you're walking so much that your heart starts to pump more and more and more and get stronger and more resilient to where it won't fail. So if you do that, you're more likely to have a better outcome than you would if you didn't. So you need to be very mindful that walking doesn't mean you got to go and do military calisthenics like Patient Zero does every Tuesday. You need to be more in the mindset of, I need to just get up and move. And if I move more, I'm less likely to have problems like a heart failure. And of course, my others that I'll run through real quickly, uncontrolled high blood pressure definitely is going to cause heart failure. Uncontrolled diabetes definitely is going to cause heart failure. Uncontrolled obesity is going to cause heart failure. And then, of course, excessive alcohol use will cause heart failure. And for people who ask me, well, what's excessive? Come to the clinic and have a visit. We'll talk about it. But I'm not going to give you that sauce right now. So you think I've given you an out to go to your favorite restaurant or bar and say, Dr. Jasper said, nice try. We're not doing that. But the point is, you need to figure out what is considered excessive. That way you can hopefully avoid things like heart failure or things like sleep apnea or both. So with that, Patient Zero, I think we've covered the risk factors. Any questions, comments, concerns before we go to testing and evaluation, my friend? Because I think we're, hitting these people where they need to be hit, right in the brain where they say, you know what, man, I'm glad that I listened to this episode. I'm probably needing to subscribe, like, and share at this point because I'm learning so much. What are you thinking, Patient Zero?
Man, I'm thinking you in your bag today, man. I'm just here for decoration at this point, man. You killing it today. I don't need to add nothing to that. But I will shout out our good friend, brother Ardu Burrell, man. We actually recording this on his birthday, but he always says that he's listening to us on his morning walk. So Art's probably not going to have heart failure.
There we go. And if that is something that encourages you as a listener, that we have listeners, number one, congratulations, because I know that's probably the first surprise. Like, people listen to y'all? Yes, they do. Quick segue, Patient Zero, I sent you a screenshot because I oftentimes send you screenshots when we get people that give us feedback. What was one of the best feelings was when I got an email in my inbox from a parent in Florida asking about getting treatment for her child of 11 years old on ADHD because they listened to our episode on ADHD in children. Like, that should tell you right now, we cooking, brother, right? And whether or not folks is eating, I mean, that's their problem. But we over here cooking, right? So Art obviously is right. That's why I say Art is getting the sauce, right? So Art, hey, shout out to you. Happy birthday, brother. Shout out to my line brother as well. His birthday's today, my line brother Dennis. So Dennis obviously and Art are special people because they both are listeners and subscribers. I mean, maybe it's something about this special day of the 29th of May, right? Maybe it's something special about that these people are all obviously awesome. But we digress. So based on that, we'll talk about testing and evaluation before folks get in treatment. So we already talked about some of the signs and symptoms. So based on that, the most common and basic way to get diagnosed, and if not get diagnosed, to know you're on the right path of diagnosis, is going to the doctor. Like, that's the most basic thing, because we will do what we call a history and physical exam, which is the bread and butter of any good doctor, is knowing how to take a good history and doing a physical exam. And if you do that really well, we more than likely can tell you have heart failure from that alone. Before we spend any money on labs or testing, we can just do it in that regard. So that's one of the biggest things. But Patient Zero, I'm going to kick it over to you. Let's just do big categories. Let's not go into the specifics of things, but what are some of the big categories that we will recommend people get? So anything that you see, Patient Zero, go ahead and call it out, my friend.
In terms of
imaging, labs, what would you say?
Gotcha. So what I would say is I like to get imaging. I think imaging, it tells a lot. Obviously your labs will tell a lot too. So, but on the imaging, you got your EKG, you got your chest X-ray, you got your echocardiogram, your labs. It's got a bunch of initials.
So we're not going to the labs because we will be here all day. But you hit the three that I think are important: an X-ray, an EKG, and an echocardiogram.
Echocardiogram.
Now, why am I
right.
telling you that? None of those three, to my knowledge, you can just go and do. You usually need a medical professional to do those. You can try to TikTok, social media, or do something to diagnose your CHF because you want to magically fix it. Completely fine. I'm not going to argue with you. That's your choice. That's your social media. That's your phone. But if you sit here and tell me I went and found a way to get my own EKG, my own chest x-ray, and my own echocardiogram, at this point, I don't think nobody going to help you. But, the man up above, because at this point, you want to go meet him. That's just what I'm hearing, right?
So I can't buy an Apple Watch and get that?
That's my point. I think you see, that's why we on the same wavelength, brother. Like people, I got a wearable, which we did an episode on wearables, and that told me I got this, and I'm like, I understand it's telling you something, but I can't diagnose you off of your fill in the blank wearable. So you need to get into care to get these things done, number one, and number two, get somebody to really understand what they're looking at and reading, so they can potentially say, yes, you have a really true diagnosis, and we need to move to treatment. Or no, it's not really as bad as we thought it is, right? And then we're not even talking about the blood work, the urine testing, and additional things like a stress test, right? Which, again, I'm not going to tell that story. I think we told about what the patient told me about their stress test and what they needed and why they thought they needed it. It wasn't until they were in the office that we realized that they had no idea what they were talking about. But anyways, the point is if we're doing all of this, you're going to hopefully get a true diagnosis. And a true diagnosis means then you now get true treatment and not a partial treatment, piecemeal treatment or something like that. So with that, patient zero, we're not going to, again, go into the details of these types of labs and what these results could be, because we want people to obviously do that with their own healthcare professional. But what are your thoughts, my friend? Because I think we're kind of hitting our point of getting to the closing. But right before we close, what are your thoughts on CHF? And then what are your thoughts overall on potential sleep apnea? Whether you say, look, I lean more towards this one being an issue, this one being an issue, both are an issue, or this is one I think people need to spend more time on. What are your thoughts? I just want to get your, as the patient and the person who possibly has more of the relatability, big word, to people who are potentially, listening and they're not in the medical field. What are your thoughts? But, give me what you got, patient zero.
So, I think about both of these things, and I think once you get to congestive heart failure, is too late, right? So I'd like to see more people pay attention to sleep apnea, because sleep apnea can lead to that, right? And a lot of these risk factors for both actually were some of the same things, right? So when you think about obesity, that's a big deal, man. That can cause a lot of health problems. And like you said, man, you can change your life just by going outside and taking a walk regularly. You know, uh, but also, sleep apnea can cause congestive heart failure, right? Right. So pay attention to how you sleep, because sleeping is so important to your everyday health. Obviously what you eat, how you work out, your diet, all that good stuff. So I would say I'd like to see people pay a lot more attention to sleep apnea, because heart issues is one of those things to where it's a squeaky wheel, right? Once you start having symptoms and when you have heart issues, I think people go get that taken care of. But sleep apnea is not one of those things. People don't take care of that. People kind of ignore that, especially in today's economy, right? Because let's be honest, you should probably take care of everything that goes on in your body. But being that you don't have unlimited resources, people tend to make decisions. And a lot of time, a little snoring in a lot of people's mind is not something that we just need to run to the doctor for, right? But I would say this: I disagree, because fixing a lot of these smaller issues, like a sleep apnea, is a perfect example. Because if you fix your sleep apnea in 2026, you might not have congestive heart failure in 2030 or 2035. Like it's just one of those things to where you want to pay attention to it. And also, kind of a sidebar, we mentioned like wearables and things like that. Use things for what they're for, right? Things work better when you use them for what they are. like wearables. Dr. Jasper made a point about wearables. I'll disclaimer, we're not saying that wearables are bad things. Wearables are awesome things. They keep up with your steps. They'll tell you what your heart rate is. They give you good information. Some of them even attract how you sleep. You may get into some care for sleep apnea because you have a wearable, right? But you use the data from your wearable as something to check on yourself, to maybe potentially get you in care. Don't use the wearable as the care. You know what I mean? It is one thing bleeds into another. So, I guess my closing comments would be: A, check on yourself, understand how you sleep, pay attention to how you sleep, because that's so very, very important. And just in a nutshell, a lot of these smaller things that you might consider small can become chronic if not taken care of. So sleep apnea, get to the doctor for it. If you're snoring a lot, get to the doctor, because I promise you, and I'm not going to speak for Dr. Jasper, but I would assume that he would agree with this. Once you get congestive heart failure, there's a lot less options for you than when you had the sleep apnea, or when you were just obese, or when you was going out drinking every night, or all the other risk factors. So I guess don't allow small problems to become big problems, would be my closing thought.
I got you, brother. Well, I'll say my two thoughts, and again, I have a lot of them when it comes to these. Option one, or thought one, I should say, is the idea that I got time. That's a misconception of a lot of people. I got time to go to the doctor, and I'm going to do it later. I have time to get evaluated for sleep apnea, and I'm going to do it later. I have time to, go look into that shortness of breath, and I'll do it later. And eventually later is 4 or 5 years, and that's 4 or 5 years of damage we can't undo. The 4 or 5 years of snoring that may not seem like a big deal will eventually cause 4 or 5 years of heart failure or heart weakness or heart wear down that's going to cause problems that we can't undo. So the I have time misconception is something we need to eradicate, so people are not sitting here thinking, well, I'm going to go when I have time, or I'm going to do it when it's convenient. You need to make this a priority. And in your mind, if your health is not a priority, your symptoms are not a priority, I guarantee it will be a priority when you can't breathe. It will be a priority when you can't walk from one place to another without having to sit down. And ultimately, the long-term effects of these things are detrimental. There's a diagnosis that, and if not a diagnosis, a treatment, if you will, that is really, really helpful, but it's really, really hard for people to wrap their head around. And I was one of those people until I had to see it in my own family members. There is a treatment called an LVAD, a left ventricular assistive device. And I'm going to make it quick. An LVAD procedure is basically where they take a person whose heart failure is so severe that they no longer have the ability for the blood to pump anywhere close to what it needs to pump. Put it like this: on a scale of 100% and 0%, the heart is pumping less than 10% of blood where it needs to go. So if you're that weak and your heart is that weak, you do a procedure called an LVAD, a left ventricular assistive device. They take you to the operating room. They basically cut a part of your heart off and attach it to an electrical device. And that electrical device is now attached to a battery where the wire comes out of your body and is now plugged into a battery 24 hours a day, 7 days a week. When you go to sleep, you unconnect from a battery and plug yourself into a wall or an outlet to get power to the battery, because the battery has to pump 24 hours a day. Your heart pumps 24 hours and never stops. This is a diagnosis/treatment that I have seen in multiple of my family members, and they are doing very well with it. But it's unfortunate that they had to have this happen because, of course, it's uncontrolled, long-term chronic heart failure that we don't want to do anything about. We don't want to go walking. We don't want to eat right. Or if we do want to go walking and eat right, we don't want to do it well and more consistent enough until it gets so bad that now you are plugged into a wall 24 hours a day. And if you think I'm joking, patient zero, go look it up. And the fact is, you know these family members, you've met them. And that's how bad it is. So the point of all that being said is that if you think that this episode is in any way talking to you or a family member, encourage them to go and get into care. Don't wait until patient zero shows up in a disguise and now all of a sudden you think, well, it's a sign, because obviously patient zero is in my office building with a disguise on, I need to finally go and get that treatment. I need to go get that evaluation. Go ahead and do it now. If you've listened this far in this episode, then obviously, as we keep saying, you're a real one. That means you obviously care about your health or someone's health, because you wouldn't listen to us for all this time if you didn't really care about health. So at this point, let's do something about it. With that, Patient Zero, I think we have hit our segment of closing out. Before we tell the people where we can find you, do you have a rant for us, Patient Zero? We may have went a little long, but I always like to give you the floor for your rant. If you don't, we'll just go ahead and double it up next time. So you tell me your thoughts. You got the floor, brother.
I'll say this, just use what you got for what it's for. Because, I spend too much time on social media, Doc. And I spend way too much time on social media because I'm looking for my foolishness. I'm looking to see somebody do some kind of crate challenge where they fall off from crates, or like where people leave their puppies a little too close to the lake and the alligator gets them, stuff like that. Like that's the type of stuff I'm looking for. But I end up seeing stuff where, these people are just making all these medical videos, man. Like dude is just shredded with a 6-pack and all this, that, and the other. He's eating pizza and hamburgers, and it's like, yeah, man, you could have a 6-pack too if you do this military calisthenics. Or like somebody else is like, if you wanna kill your liver, drink alcohol. If you wanna heal your liver, you eat lion's mane, mushroom or something. And I'm like, it's not the same thing. Like, why do you like how's this even a comparison? But whatever. So then they say, if you want all these mushrooms, in one place, you could drink mushroom coffee and all of a sudden you just go be healthy. Like, bro, so what I would say is people don't use things for what they're intended to be. Social media is purely entertainment. And maybe to get a little news or maybe to call your attention to something. It's not your doctor. It's not your fitness coach. It's not your nutritionist. It's just people making content. Use it properly. If you're inspired by an idea that you saw on social media, great. Talk to a professional. Don't make social media your primary source of information. Your wearable, same thing. Love the wearables. Love that it keeps track of steps, even though my Apple Watch is the biggest hater on earth, because it's like, man, what you been doing? You've been sitting down too long. It's like, man, I'm just chilling. Like, what's your problem? But, it's like, hey, man, you ain't been doing nothing. Again, if my heart rate is elevated, I'm not going to go and just take some Bayer or something to kind of thin out my blood. I'm going to just say, I'm going to take this information and I'm going to say, Dr. Jasper, I need you. This is what's going on. This is what my wearable's saying. What do you think? Because he's the professional. Steve Jobs, Tim Cook, they ain't go to medical school. They just created some stuff, which is cool. But like, I don't know. So use things for what they're properly meant for. Social media, purely entertainment, get an idea, maybe a little news here and there. Do some research after. Your wearable, get the information, go to the doctor. But use things for what they're meant to be used for. Don't let just replace stuff, right? And that's it. That's fine.
All right, brother. I think that's a great rant. And again, it's one of those rants that I appreciate because it's helping people. What was it? Square bread with square meat. Like, I don't know on that one. Now that was funny.
That's a problem. Like, I'm really irritated by that because I done spent this time crafting this sandwich. And I put in my Ninja Foodish so my bread could be toasted and I can have the cheese melted to where it needs to be. It's like awesome. And then I take this one bite and all I got is bread and cheese because the meat is round and the bread is square. No, that's irritating. I'm sorry. It's not helpful, but it's still annoying. I'm just saying.
The fact that it's a callback to a previous episode that tells me, number one, we're doing something right, because I'm sure somebody out there is going to walk up to you or me and be like, you know what? I agree. And all of a sudden they just walk off. And I'm going to be like, what are we talking about? And that's the point.
We're talking about round meat, square bread.
No, I was going to say, at that point, I'm going to be like, they must be talking about some Patient Zero said. Because no one ever walks up to me and says, you know what, Dr. Jasper, I agree with you saying on heart failure. Like, no one says that, right?
Nobody can agree.
Let me say this. I have a few people that say appreciate it. But don't nobody come in and be like, you know what? I agree with that whole thing you said on heart failure. They remember about Family Matters. They remember about us having a debate on shirts with pockets. No one walks up to me and talks about sleep apnea, high blood pressure, kidney stuff. So that's why I said it's funny, because that's the part people remember, apparently. Like the
Doc, but you got to understand though where we're both coming from. Like they have to agree with the things that you're saying about congestive heart failure because they don't have the education to know it themselves. Like, I don't know this. I got to trust you on that. But hey, we've all been there where we picked out a shirt and be like, man, this shirt would be cool if it didn't have a pocket. Like, we've all been there. Everybody can relate to that. The average person can't break down why blood moves through the body. You might have a doctor partner that's like, bro, you broke that down so good, man. You was right by everything you said because he went to medical school. Most of us didn't. But you know what? All of us made a sandwich. We all made a sandwich before. That's why people agree with me, because I'm talking about regular stuff. You're talking about stuff that most people don't know about. That's why we have a show, because we're telling people about this stuff that they don't know. That's why I'm just saying, that's why nobody can agree with the stuff you're saying. Of course, people could agree with the fact that they're mad at the little pimple-faced kid for texting and driving, because we all deal with that. But hey, nobody knows the science of why sleep apnea exists. Mm-hmm. That's why we depend on you. So people gonna be like, you know what? Appreciate you, Doc. But nobody's gonna be like, you know what? I agree with that, because they don't know. I don't know. I got to trust you. That's why you hear from me. That's all I'm saying.
A rant within a rant. So I don't know if we'd have doubled up. If you are not a fan of episode 51, I don't know what you're doing, because that's gold right there. He literally broke down why his rants are going to be classic, because, hey, I'm just that relatable. That's why, again, when we walk into council meetings, people get up out their seat and basically come walk all across the room. That's why people come to the show, my friend. And again, we don't have to debate it. We've already had this settled a few times. But I appreciate you, because that was hilarious. Okay. So with that, patient zero, we will close out episode 51. We're almost to the finish line on the end of season 5, brother. And before we tell the people where they can find you, I just want to, again, give ourselves an applause, because you know what? We are constantly killing it, brother. We are literally letting these people think that we over here somehow magically just pumping out episodes, and they don't realize we working, brother. Like, I've had people say, y'all record an episode almost every week. I'm like, yeah, it's pretty much every week. Like, we in here. We are literally doing this. And at this point, if you have listened this far and you have not subscribed, liked, shared, or done something to show that you are a huge fan of Byja Radio Show, because it's not a podcast, Patient Zero.
It's not. It's a radio show.
It's a radio show. If you are a fan of the radio show, you need to go ahead and do that at this point. Now, you can find Patient Zero and myself outside of this, but if you come to these episodes and you appreciate these episodes, let's do our due diligence and get them to kind of blow up. And we're talking to you, Art. We're specifically talking to you, since it's your birthday, and you, Dennis. We're talking to you too. Don't just be taking it all in and not sharing the wealth. Okay. With that, because I was about to get on my soapbox. With that, Patient Zero, those darn alphas, right? Like, just want to keep it all to themselves. Want to be smart by themselves. I can't stand them. With that, Patient Zero, what you
so we can look down on the not smart people. We like
those alphas, just hoarding all the knowledge in podcasts and the radio shows. I can't believe it. Okay, what you got, Patient Zero? Where can the people find you?
You find me at Becknell Media on Instagram, George P. Becknell II on LinkedIn, and George_Becknell on Twitter, because it's still Twitter to me.
All right. So people, if you've listened this far, again, we appreciate you. You can find myself and the clinic at www.byja.org for Byja Clinic. For the Charitable Alliance, our nonprofit arm of the clinic, where we are using that to give people who don't have the funds and the means to get access to healthcare, a way to access healthcare through the direct primary care model. That is the Byja Charitable Alliance. You can find us at www.byjaca.org. You can find us on Instagram, LinkedIn, and Facebook at Byja Clinic. Consider the Byja Blueprint book, which is definitely a guide to direct primary care for patients, physicians, and businesses. And last but not least, again, we appreciate you. With that, Patient Zero, we're going to close out. We'll see you all next time.